Yeah, hi everyone, and welcome to my channel. It's me again, once more, Dr. Wan. And I just want to say something with regards to diabetes, which is, which is a hot potato here, and also some related diseases when it comes to that particular pathology. Like I said in the other video, that diabetes doesn't come alone, especially when it is not under control. Yeah, it brings in so many complications which you can't imagine. Like I said, it comes with over 17 other diseases. So this afternoon, I was reading this book, as you can see, that talks about prostate cancer and other related document, and you can see for yourself. Yeah, so I spent the whole afternoon reading all this, and I choose to summarize it a little bit for the layman to understand. The whole thing is this. When you are having diabetes, especially when you are over 50, whether you are Caucasian, whether you are African, whether you are an American, Canadian, it doesn't matter. You just have to do all what is required to keep yourself safe. That is, that blood sugar should be under control. Once it starts fluctuating, or it gets to what we call roller coaster, and you can name the rest, Down syndrome and sigmoid and all those things, I tell you, you are in deep shit. I'm sorry using that word deep shit, but just want to make you understand the implication. There is the value called PSA. So PSA has a lot to do with your prostate, how it is growing, and it's terrible for those who are diabetic, especially when the diabetes is not controlled. The PSA value spikes very fast. Yes, I know if it is below 2, that's fine. But for diabetic patient, that value spikes as the HbA1c spikes. So they go kind of alongside. So the key thing is to keep that sugar level controlled. And then like so, it might also have an impact on the PSA value, as I'm reading from this book written by a specialist. So what I'm here to say is, you might have the PSA value over 4, but it doesn't mean that it is cancer yet. But the trouble is, you have difficulty in the washroom. Most of diabetic patients with that value of PSA greater than 4 have trouble because the bladder is not completely empty. Most of the time, they go to the washroom and they even have that hesitant to urinate. And having said that, there's also that dripping effect that comes alongside. So make sure you get this value checked. Having said that, there's also another type of diabetes which we call type 3. To be more specific, I will say the diabetes that acts at the level of the pancreas. That is, the pancreas undergoes kind of an aggressive attack from the environment. It could be also your autoimmune system reacting towards you. It could also be medication, especially those who are on cancer medication. Those molecules, they undergo metabolism, and the metabolite at times ended up irritating the pancreas. And once that pancreas is irritated, that's all what happens. That's the sense that the insulin being produced is not enough. There's that question of insulin sensitivity. Once that insulin sensitivity is being tampered with, that's when trouble kicks in. There are chances that you develop what we call insulin resistance. When you develop insulin resistance, that's when the sugar value spikes. So we should not only pay attention in managing the symptom, but also look at the cause, how we got to that situation. So if you are managing just the sugar value in your blood, you are not doing the right thing. You need to also handle that other aspect, which I call it here insulin resistance. And a typical example is weight gain. So if you look at most men, they end up developing what we call kind of belly stomach or pot belly stomach, or sugar belly. I don't know, you can call it the way you want. But the essential thing is the hip to waist ratio is above 1. When the hip to waist ratio is above 1, that's not a good news. For sure, you are driving towards insulin resistance. So you need to see how to invert that value. If the value is less than 1, that's good news. The insulin now tends to pick up. That is, the insulin sensitivity increases, which is good news. But when the insulin sensitivity starts dropping, that value also hip to waist ratio spikes. So that's another guide I just want to advise everyone here listening to me, my followers. Please don't forget to subscribe to my channel as well as my Facebook page also. So the discussion continues. So another aspect to look at it, we just talked about the PSA value. So when your PSA value is more than 4, it doesn't really mean that you have cancer. But the bad news is it has a lot to do with your insulin value and consequently the blood sugar value. So the other aspect here, it is colonoscopy. Once you are over 50, I strongly recommend everyone, black or white, to go for that value also, to go for it to be checked, because it has some connection also to do with the blood sugar value. Especially for diabetic patients, the situation is not the best. So get it checked and make sure that the colon is okay. You avoid having what we call the polyps, because you can find yourself in a situation where there won't be any turning back. So a stitch in time serves 9. So those are the key things I just wanted to say this evening, which these are all diseases that they are related to diabetes. So take home message: if you are a diabetic patient over 50 years of age, make sure these 2 things are done. Colonoscopy is done. Make sure that there are no polyps, and then the PSA value also, make sure they are checked. And then the other things like blood values, cholesterol, and all the rest, those ones, you have to check them, blood pressure as well. I'm not saying that you neglect all the other ones. So make sure you know your numbers. Being diabetic or even not, know your numbers. That is the blood pressure, you know it, the cholesterol, you know it, the PSA value, you know it, and also colonoscopy done. You have my email, you have my phone number, you have my contact. So if you want us to talk further on this topic, diabetes and related diseases, I'm more than happy to have a talk on that. And I look forward to bringing in specialists who could also add more flesh to the bones. Thank you for listening. Don't forget once more to subscribe to my YouTube channel as well as my Facebook page. And that's it. Have a wonderful evening and enjoy the rest of your day. Thank you, Dr. WAN. Ciao.